Thank you. Good afternoon to everyone and welcome to this afternoon session, session 3, Overcoming Community and Social Issues, a whole of society approach. I missed the morning session because I was at the Academy of Science in another important discussion on SDGs. But just now, Sri Michael Yeo was saying about the role private sector will play in this recovery, national recovery policy and program. But now to shift our attention to the people, to the community, to the rakyat, to the everyday citizen, because it cannot just be the effort of government or the effort of one section or two sections, but rightly, I think the theme highlights the whole of society or whole of nation approach in addressing not just community, but social issues. As the MC has said, we have a good panel. Each of the panelists have 8 minutes, which is a bit more generous than some programs I've been in. They would share from different perspectives because multi-stakeholder engagement of civil society, women's groups, parliamentarians, educators, because the issues in education is quite critical, and whether parliamentarian or professionals is quite critical in addressing this. While we describe the issues, I hope we can move on to concrete possibilities for the future to enhance the current initiatives, to take it further. Why have we not been successful enough? And also the exciting time next week in Parliament, would it jadi or not? Would it have other issues and things like that? So that will be interesting. So let me invite Professor Emeritus Sri Datuk Dr. Sharifah Hapsah, who needs no introduction. She was my VC when I was first recruited to UKM, or when I applied to UKM, and Sri invited me over. But NCWO has been a formidable movement of women in policy and at grassroots. And over to you, Sri, this afternoon as the opening speaker.
Thank you, Denison, and thank you for inviting me, as you said, as president of NCWO, to share our views at this summit. First, we would like to record our appreciation to the government in its initial response to COVID-19 and now for making plan for the national recovery. A lot has been done, and we noticed that. Let me tell you a bit about NCWO. It's an organization that represents more than 200 women organizations of all ethnicity, faith, cultural background, interests, professions at national and state levels. But we work towards a common goal of gender equality and empowerment. So it represents unity in diversity. NCWO has the capacity to help in the recovery plan. I'm very sure about this. Firstly, we have a big, large talent pool of very talented women with experience in almost all fields of life. They are ready to contribute ideas and energy and other resources for the plan. Actually, this morning you heard from Dato Azlin. She's chair of one of our affiliates, one of the biggest affiliates, the NAWEM group. So you can see how powerful the group can be. And of course, through our vast network of women, we connect through IT. It has become the channel to bring women's voices, women from diverse groups, to policy making, for disseminating information from government and other authentic sources to the people, and it is a touch point for community actions, and we have a track record of accountability. So the whole society approach is no stranger to us, as Denison said. Even in the early phase of the pandemic, through our health committee, NCWO joined others in the effort to contain the epidemic. We partnered with universities, the media, the private sector to collect donations and to supply PPEs, or personal protective equipment, ventilators, monitors, and other hospital equipment. And we focus on the pediatric COVID cases in the Ministry of Health and the university hospitals. And of course, our women volunteers, so many of them who volunteered time, money, and effort to help the needy with food and other basic necessities during the early phase. So we will participate in this recovery plan with the understanding that we will continue to live with COVID as new strains emerge and so on. And social distancing is the new normal. And digital technology is the new way of life. And we also understand that collaboration is essential because no one sector can win this war alone. I will now give you some gender perspectives to the community and social issues in the recovery efforts, and then give examples on how NCWO can help through these examples. First one, and the most important and crucial, which I think is missing, is involving women in the decision making. And we know research has shown that to be successful in your endeavors, diversity in ideas is important in decision making for innovative solutions. In this case, is gender diversity in the decision making at all levels. For that, for a start, we would like to see the voice of women. I'm not talking about women, yeah, as an individual, but the voice of women represented in the National Task Force and at all levels in the recovery plan. As we know, women have been the worst impacted by the pandemic, particularly the dependent wage earners in the informal sector. And the progress made towards gender equality have been eroded, and at least a decade of setbacks. And the cycle of inequality has to be broken by representation and participation. And by representation, we mean bringing the gender perspective to decisions. If the gender perspective is injected in the plan, more than half of the solutions can already be achieved. My second example is vaccination, which is important. It is one of your indicators, yeah? So increasing the number of people vaccinated is crucial in the recovery plan. And NCWO has embarked on a campaign to encourage women and families to get vaccinated. You know, if you get women on board, you'll get the whole family, you get a whole community. We can also participate in the vaccine program itself. The mobile community, the mobile vaccines, for example, and the community vaccine mobilization program, MOVAC. This is under Ministry of National Unity and the Housing and Local Governments, so that we can ensure vaccine access to vulnerable groups, particularly women in the rural areas, the elderly, people with disabilities at home, and in care homes. And we can help, you know, by identifying the recipients, registering them, reminding them, and even help them with transport. The third example I'll give is the home-based care. Now the government, to reduce burden on the hospitals, is encouraging home care. I think category 1 and 1 to 3, I think they encourage home care. And also now home quarantine. So women can help reduce this burden and help with the indicator, of course, by reducing the burden on hospitals. And for this, I think if we work together, give some training to the women and give SOPs, clear SOPs and access to medicine, I think this can be achieved. Another example is the database. We know a lot of women now require aid, particularly welfare aid, and a lot of the M used to be M40, they now become B60, I think no more B40. And they are mainly homemakers, as I said, you know, wage earners, daily wage earners, unprotected jobs, and they have lost their earnings, their income. And, you know, they are at risk to poverty and malnutrition and so on. We have e-Kasih. And I think this e-Kasih must now be updated to include the new vulnerables, the new people who have dropped into this. And I think this should be an inclusive exercise. Don't just leave it to like politicians or local agencies. I think we can collaborate. The NGOs can help, the resident associations, the RELA and Jabatan Perpaduan and so on, so that we can cover all the vulnerable groups. We have to update this because a lot of the planning, the programs, the fiscal policies need this information, and also the economic empowerment programs that we will do. Another issue that I think is very important now, we keep on looking at the economic empowerment and so on. I think is a psychosocial impact. We even saw initially when we had the lockdown, but now it's becoming more and more. Loss of jobs, the lockdown, the isolation, you know, they have given rise to psychosocial and mental trauma in families. You see the desperation, anger, they feel helpless. And these have driven people to domestic violence, child abuse, divorce, cybercrime, suicide. Of course, pregnancies have also increased, you know. The government need to build more shelters, and this should be complemented. The organizations, women organizations can complement this, managed by them, having more shelters. Another one is together we can help develop new SOPs, because this is the new way of life, you know. There's a lot of social distancing. The SOPs that we have now for managing these sort of cases like domestic violence, sexual abuse, we need to change the SOPs a little bit. And also, I think managing hotlines, people need help, and telecounseling or even face-to-face counseling. I think this is very important. And one of our organizations is the Malaysian Nurses Association. The first news that we got was from them about how the burnout syndrome is occurring among the frontliners. And you know, frontliners are mainly women, nurses and so on. A lot of them are women. And you know, they are worried not just about getting the infection, but also passing it on to the families. And they have been deployed from other world, you know, they're not in infectious diseases, but they now have to deal with COVID. There's a lot of anxiety going on, and counseling has to be stepped up. It's not just about the role of us NCWO helping in this, but we can bring this to the attention now. I think it has to be a very important SOP in the Ministry of Health, the counseling issue for the frontliners. I think I'm going to stop there, Denison, and perhaps wait for questions later.
Okay, thank you. Thank you very much, Tan Sri. I think you affirmed the point of representation, participation, the voice, but also some very constructive and practical suggestions that need to be addressed in this context. And I think that is very significant in the way that we rebuild in the way, especially the burnout, the psychosocial impact. I think more needs to be done in that front because it's not a short-term, but very much a long-term issue that we have to live and change lifestyles and patterns and so forth. Now, let me move on. Thank you, Tan Sri. And let me move on to YB Maria Chin. We all know her well in her CSO, in her parliamentary work as Deputy Chair of the All-Parliamentary Group, Malaysia on SDGs, and a lot of her work among the urban poor and the flats and so forth. Over to you, YB.
Thank you very much for inviting me, and thank you to KSI. For me, I feel that, you know, this country definitely needs a national recovery plan. Though I wish I am not so enthusiastic as Datuk Sharifah, but I wish it really came much earlier. But well, better late than never lah. So the plan definitely have the ingredients where indicated actually key major challenges. But there are still a few more categories that I feel are quite lacking. One is the time frame, yeah, for the economic recovery, especially. Although in the health sectors there is a time frame for the vaccine, but nothing that tells me, you know, about strengthening the healthcare system, where I feel that at the present moment, we need immediate and medium term responses for the next 6 months, you know, as immediate as that. Because we all know that, you know, our health system is really at breaking point, and we need to save lives. Yeah. The other thing I feel missing is really the risk factors. We need to now be able to foresee what are the risk factors that if the plan doesn't work, or if there are more challenges that we didn't foresee or we may foresee but not so well prepared. That needs to be in it. So that's why I'm hoping that the council that's going to be formed will be able to give us a much more detailed plan of action for the next 6 months. We really need to focus. 1 month has passed already, or 2 months have passed, and now we are getting 6 more states, yeah, almost reaching to what the Klang Valley has experienced, with high spikes in cases. So that is something really to watch out for, and we hear of the Delta variant. So we need to act fast. So therefore, the other thing about this pandemic is that it really brings up a few issues of concern. One is the build-up of inequalities and discrimination, as some of that has been listed out by Datuk Sharifah with regards to the women. But the inequalities and discrimination is also appearing in vulnerable and marginalized communities. That has to be dealt with. There's a deepening of poverty, you know, from M40 you jatuh to B40 and going down. And due to the loss of jobs and businesses closing down or not getting enough income to pay for staff. So that has to be dealt with quite immediately. The other one is really the governance standard, the setting up standards within the institution so that we are able to run this national recovery plan much better, with more transparency and accountability, and with more human rights standard. And I think that this pandemic has brought up this whole issue of identity politics and populist politics. I think it's about time we stop all this. Stop using the use of race, religion, and political patronage to actually gain support. This is the time now. This is the opportune time for us to actually focus and try and save as many lives as possible. That should be the right priority. That should be the focus of this recovery plan. So I just have a few recommendations that perhaps the council can think about. One is the people's participation, which has been said before, but I think that it has to be from the ground. Yeah, let us look at what are the people saying at the ground, because they can be part of the solution. They are not the part of the problem. They are part of the solution, and we have to actually bring them into the plans. See, the example of Kuala Langat Forest Reserve is a good example of people's voices, yeah, and how effective it is, and the kind of leadership which will actually listen to this people's voice and review its action and go for re-gazettement of the Kuala Langat Forest Reserve. That is what we need. yeah, when we talk about people's participation. The other one is that if we want to really deal with the inequalities and discrimination, let's take a bold step. Bring in a social inclusion bill, which actually will help us to manage the poverty, the discrimination, the inequality, so that we actually uphold this concept of no one left behind. Rather than keep it as a concept, let's make it more practical. And the key challenges facing us today, like education, health, jobs, economic growth, yes, is well captured in the plan, but still, like I say, we still need a detailed plan of action with time frame, monitoring mechanisms to ensure implementation actually fits the plan and with no U-turns or confusing instructions. Risk factors and also sharing of granular, not just sharing of data, granular data among agencies and with the public, so that we are able to actually zoom in on key problems. I think that is the main thing that we really need to do. The other one is really rebuilding our research and development so that we are able to meet the emerging demands and also possible next wave, of the pandemic. Our R&D has been underdeveloped for many years. It's about time, and this is the opportune time to actually look at our R&D and see where we can actually build ourselves better. The other one is that if we are talking about economic recovery, really, this pandemic just bring up to me that perhaps we have to consider this whole issue of devolution of powers between the federal and the state areas in areas such as the education, the health, trade and investment, transport, water, and even housing. Because if you look at it, most of the states face the pandemic, and most of them depend on the federal to actually provide it the direction and the resources to run the health services, to actually deal with the pandemic and so forth. So perhaps there has to be some kind of sitting down together and consider where we can actually help to decentralize some of these areas, so that state and federal will be able to work together in collaboration to move our economy forward and meet the social needs. So I'm really hoping that this will actually happen. I mean, Sarawak is actually asking for it, so let that be a good stepping stone towards a better collaboration and coordination of our resources. Our institutions, of course, everyone says we need to really strengthen it, but most importantly is the interconnectedness, sharing of information, sharing of partnership, moving together in partnership, so that we will be able to not just grow together and develop together, but it will also help to weed out the corrupt practices, abuse of powers, and the use of violence. And so therefore we need laws. If we want to do any kind of decentralization of powers, we also need laws, like for example political financing, improving and strengthening MACC, implementing even the IPCMC, and all these needs leadership and serious commitment in order to build back better. The last, which Dato Sharifah has actually touched on, gender equality is really very important. If we want economic growth to succeed, we have to resolve the inequalities faced by women who wants to also return back to the workforce, where it will be safe enough for them, fair, and with decent working conditions. So for example, most important is really the issue of childcare. Be it community-based, work-based, or whatever, these have to be set up for women so that they can easily ease back into employment. So with that, thank you very much.
Thank you, YB Maria, for those words. I think you you raised many key points like social inclusion, bill, governance standards, the most urgent and critical devolution of power in terms of decentralization. I think what we are faced with is there is a lot of suggestions, but the rhetoric seems to be high. The challenges are unimaginable levels of death and cases still. Of course, the trend with higher vaccination might reduce, but the whole of nation approach requires a more drastic look at things. And I think what has been raised is something we need to have the political will in that context. And YB, Maria, and Tan Sri have raised these issues of inequality and so forth. Now let's move to another huge area, which is education. We have read stories of people climbing up trees to access internet, and the disparities towards that, and the change from building-oriented to technology-oriented education. And Dato Parmjit needs no introduction, the president of the Malaysian Association of Private Universities and Colleges and Asia Pacific University, who has been in the forefront of technology and change. Over to you, Dato, for your 8 minutes or so.
Thank you, Denison, and thank you, KSI, for inviting me to speak. First of all, let me just quickly introduce MAPCO. MAPCO is a collection of higher education institutions, mainly at the tertiary level, and includes branch campuses and all other private universities. Our role mainly is to be represented at policy-making level, and for which we are very grateful, and we've been very active. Even during the height of the lockdown last March, we managed to reach out to various levels, working with EPU, presentations to the AAC chat by the PM, and so forth, to enable us to continue and to also seek a reprieve from the regulations governing education for the time being. Now, as soon as the pandemic hit, we were able to go online quite seamlessly, and I'm very proud to say that we were able to substitute face-to-face teaching by using technology and going online and addressing all learning needs. But of course, there were difficulties of various forms because this came down on us very suddenly. There were foreign students who were pretty desolate, who had to go back. We facilitated their going back. We also facilitated as a group to take all our local students back in our own vehicles and buses, which was done quite seamlessly again as the united grouping. And the other one was one of hardship, where many of them got into financial difficulty, had no money for food and so forth. And I'm glad to say that the industry was very supportive, and we responded quite quickly and helped everyone who needed any kind of help. But I would like to now go into the issues relating to arising out of the last 1.5 years of not teaching face-to-face, and also in relation to the pandemic. The number one issue is affordability, and YB Maria has already said people dropping from M40s to B40s and so forth. That has been a huge issue. As an industry, we responded. We responded within the means we have. Many of us created hardship funds, evaluated those genuine cases, and we provided the relief that was required. But the big concern is, what about the new students? Families who have been affected, and how will these kids now be able to get into, to get themselves educated at the higher level beyond school? We must not take that lightly, because that will actually give rise to socio-economic issues going forward. where a large proportion will not be educated adequately. And more so, it will also affect economic growth, because we must not forget that the private universities actually have about 50% of all tertiary level students in Malaysia. I'm talking about Malaysian students. So the split between public universities and private universities is about 50-50. So if families cannot afford to put their kids through higher education, there will be a reciprocal drop in the talent output for the country. And as we know, talent is much required ingredient for economic growth, and the country can ill afford that. So that's one big area where the talent output is going to be affected. Now, what about the issues over the last few months and some practical suggestions? Social issues. Tan Sri Sharifah has already mentioned the psychosocial impact. There has been an impact on young people too, who are social animals, as we know, and not being able to integrate and be on campus together has had a major mental impact as well. Transitioning from school to employment should not be underestimated. So, as we know, the university system takes in school kids from schools. And our role is to ensure that they eventually emerge as professionals and the type the employment sector actually desires. So that 3 to 4 years students spend on campus are actually transition years where kids transform themselves into professionals. And this is where professional development takes place. They're leaving home for the first time, and I think many of us who've experienced varsity life in the past, we know we grew up to be a lot more independent after having left home, and we begin to take responsibility for ourselves. But not being on campus, some of these elements are lost. Some of these benefits of being away from home and being on your own, looking after yourself, very much the growing up aspects of before you get to the employment stage. Development of independence and looking after self, very, very important. I mean, the absence of social interaction, physical social interaction, I mean, that has a huge impact in the development of graduates. And also, we always hear about the soft side being a complaint by employers that students might be academically equipped. They may know the technicals of what they're supposed to learn, but they can't present themselves, they can't work teams, and they can't communicate, and they don't have the level of confidence required. Now, all this is part of campus development. Online learning is not going to substitute any of this development aspects. So the benefits of campus life has been lost, networking, forming friendships, and because we have a substantial number of foreign students here, we also lose out on the intercultural aspects as well. Going forward, I also see another issue. At the moment, we know this is a reset, and we also recognize that lots of jobs will not exist going forward. We also know that there are new jobs that are coming on stream. My worry is, how do we actually get young people to understand all this? There's lack of visibility, and I think this should be part of the recovery plan, that we should have, we should take solid steps to ensure that there's some visibility as to what the world is going to look like beyond this pandemic. Now, due to the lack of visibility as to where the opportunities are, we also find the informal economy growing beyond what it should be, because they are now graduating with skills that are not relevant and they're not getting the jobs. So the upskilling and reskilling activity that's going on again requires a lot more awareness to be created among young graduates so that they can actually be re-equipped with current skills. Thinking about all these issues that I have mentioned earlier, what we really need is right now an enabling ecosystem. The education sector is a highly regulated sector. So we need enabling ecosystem to make sure that going forward, the methodologies by which deliver education can be accommodated. And the next one is the big item that is very worrying is affordability. A lot of people might say that private education is expensive, but that's what it is. It is not a sector that's funded. There's no funding available. It has to survive, and it has played a significant role educating 50% of Malaysian young students every year. That's what it takes in. I hope there will be some way of reducing the cost of operating private education so that the public can benefit. But unfortunately, this sector has never ever been supported. It has absolutely no incentives available to it. It finds it very difficult to operate below the levels at which it charges what it does. And not forgetting, I don't take pride in running this sector, because really this should have been a state responsibility. But we're filling up a gap. Where do these young people go who can't afford to go overseas? So in that way, it is a sector that needs to exist, but at the same time, it needs to be facilitated to a level so that everyone who needs to be educated gets it. And right now, in the way a lot of parents have lost their jobs, we've done our part. We've done our part. In fact, my own institution has taken every single application for aid into consideration. I'm glad to say that 83% of all applications were approved. I mean, these are from parents who've lost their jobs, students who've lost their parents, all sorts of reasons. We have done as much as we can, but we can't really go far beyond that, because otherwise we are asking ourselves to shut down because we can't operate at losses. Yeah. So affordability and enabling ecosystem is extremely important. Creating visibility as to where the future of jobs is very, very important, so that children can actually decide what they want to do. Finally, the system also requires revamp of the UPU system. A lot of success in jobs is driven by passion in young people. And if somebody is very passionate about becoming something, but then he's offered something else, we're not going to get a type of talent that's highly enthusiastic, highly productive in the long run. So we have to be able to match passion with the type of course offerings we have and the type of jobs that are available. So it really requires a rethink. Thank you. With that, thank you, Denison.
Thank you. Thank you, Dr. Parmjit. I think you have raised many critical concerns that require a real rethink. And I'm not sure whether private educators are in close consultation and in this context. And definitely the points that you have raised, affordability, deregulating the sector, as what Maria raised on decentralizing, creating a more enabling policy setup. I'm sure Tan Sri Sharifah as well can comment on this area. But I think you raised a point that I've not heard many people speak about, is really the future talent and what traditional learning, online learning has its benefits, but the real traditional learning, the loss of that personal touch, interaction, becoming adulthood and so forth. I myself remember that when I did my undergraduate studies, I had to leave home, and that in itself is experience at 19 or 20 in that context. We have a last and final speaker, YB Dr. Kelvin from Kuching, the MP of Kuching. He's also the treasurer of our all-party parliamentary group and very active on localizing SDGs. I'm sure YB, from your professional expertise in the medical area as a member of parliament and on grassroots areas, and also from Sarawak, which also has its area of challenges, East Malaysia. Over to you for your intervention.
Thank you so much, Professor, and thank you so much, KSI, for inviting me and giving me the opportunity to share some thoughts on this very, very important topic, especially how we can overcome community and social issues, and by adapting this whole new buzzword, a whole of society approach. So I'm not going to share very long, but I just want to stimulate some thoughts and just to share some of my views on a general term. And I do have to apologize after the sharing. I may need to leave because I need to catch a flight to KL soon in a few hours. And but I hope this sharing will be beneficial. So as we know, actually a lot of my distinguished panelists has touched a lot on the issues that I've talked about, and I wouldn't elaborate further, but I just want to throw out some questions and some thoughts for us to just ponder upon. So we know that COVID-19, I said this many times, COVID-19 is unprecedented. It's a form of stress test that has exposed all kinds of inequalities and institutional gaps, chronic neglect of important systems, including our healthcare systems, gaps in our social security net, and so on and so forth, causing all kinds of deepening of poverty, inequalities, discrimination, and even to certain extents in certain area, oppression. So you see, when COVID-19 hit, it was a reset for all of us. The fact of the matter is we all started at the same level, even as doctors, because there was zero understanding of this virus. It was so new. So we all actually started with a clean slate, and we are actually learning day by day, day by day. But as you know, COVID-19 progresses and it turns an ugly head. It exposed so much frailties in our institutions, and it impacted us like never before, biologically, socially, psychologically, and even spiritually. So such change has catalyzed some kind of reset or even mindset of how we do things. It has forced many of us to admit our mistakes and how we should be doing things differently. And of course, I always joke about this, it allows a lot of civil societies, NGOs, activists, reformists to an opportunity to say a big "we told you so" since the beginning, because they have been pushing for a lot of these necessary reforms that is so necessary that the gaps have been multiplied and exposed even bigger due to this current pandemic. So as the title suggests, it also pushed forth a new buzzword, which is this whole of society, rather than the common top-down approach commonly practiced even in our country. So basically what it means is community-centered approaches that mobilizes assets within the communities, encourage equity and social connectedness, and increase people's control over decisions that affect their health, their lives, the economy, and so on and so forth. So you know, many say that in order to win this war, I mean, the fact of the matter is we cannot kill our enemy, but I like to term it better, in order for us to coexist more triumphantly with our enemy, in view of the endemic COVID-19, we need all hands on deck, especially to empower community champions on the ground, so that we can deal with issues effectively, specifically, culturally sensitive, targeted, and sustainably. So this is why as Prof. Denison introduced, I'm very proud and honored to be part of the APPGM SDGs in Parliament and their initiatives, because they strongly believe in these fundamentals, especially empowering the people on the ground to make sure that no one gets left behind. And this, of course, includes vulnerable groups, women, children, and so forth. It involves all stakeholders, government, ministries, agencies, NGOs, ketua kampongs, tuai rumai, community champions, and so forth. Even in my constituency of Bandar Kuching, our focus is a lot on squatters empowerment, basically slum incubators, focusing on 3 main issues: is economy, health, and of course educations. So I would love to share some of my learning curves. Fact of the matter is why it has to be whole of society, not just top down on how the YB or the representative of that community feels it should be. Sometimes we think what the community knows once, but fact of the matter, we do not know what they actually need. So I mean, like for example, in one of our limbs, the economic limb, in one of the squatter area, we thought that to increase their income, the ladies, we realized that in this squatter areas, the men will go for work in the daytime. They work normally odd jobs, daily paid labor jobs, and the women are at home basically doing nothing much. So we thought, you know what, we can empower them, give them some passive income if we give them a skill. So we thought, I mean, again, we thought the best, and this was after consultation with the NGOs that was working with them, we thought the best was cooking lessons to the women, and we pitched it to the women in the community. To be fair, there was no objections. They did not say it, but then there was also very little enthusiasm to the suggestion. So then we dig further, we ask more, and really listen to their voices, because as I said, they have to be empowered to make decisions for their own lives. So then we realized that, you know what, they are not so keen on cooking. It is like a stereotype of women cook. But actually, due to their culture, their background, and where they come from, they say, you know, we want to learn how to weave, make baskets, make handicrafts, and for that, we can sell or even use for our daily use at home. So instead, we shift our whole strategy to get people to teach them how to weave. We connected with the Sarawak Craft Council so that to help them sell their items and also grade their handicrafts to make sure it's of a certain standard that can be sold even in an international market. So this is an ongoing project. On the other squatter area that I'm doing, they decided to do chili planting. A lot of them are, of course, of a different ethnic group. Again, cultural preference, they decided to do chili planting, and we are empowering them and allowing them to do that. Of course, I really like what Professor shared just now in terms of education. And one of the big headaches or the big passion that I have is trying to address the educational issues of the squatter areas. We are now trying to empower more mothers to teach the young children in the squatter area, giving preschool education. We know now when schools are closed, the kids are running around, they don't have laptops, they don't have tablets, they don't have internet. One squatter don't even have electricity. So this basically is a huge challenge to reverse this inequality, helps these children catch up, especially missing out in schools, and not just lessons, but the whole social aspect of learning in a school environment and a school ecosystem. So with that, I mean, sharing how moving forward, in order for any national recovery plan to work, it will need all of us to work together, and especially all to understand what it means to live with COVID-19 as an endemic. It does not mean that we pretend that COVID-19 does not exist, but we have to, as I said just now, we have to coexist triumphantly with it. And for that to work, collaboration is so important, as everyone needs to internalize and understand their role in taking care of their community, not just to #stay at home, the mantra we used last year, but to stay safe, even as we continue with at least some form of normalcy in our life. So you see, governments, leaders have mentioned so many times we need to learn to live with COVID. But what does that actually mean? Can people actually visualize and what that entails, the new SOPs, the new habits, the new adaptations that we may need? As I said, COVID-19 has exposed so much gaps within the rich and the poor has increased. So how do we actually do it? So it has to be specific, and let me summarize with this. We need to learn from our mistakes. The best lessons learned are from the mistakes we make. All decisions must be science and evidence-based, guided by ground realities, lived experience, and expertise of all Malaysians. There has to be, I fully agree with Baby Maria, there has to be a clear timeline, short-term, mid-term, long-term, of what can be done. Number two, there has to be different variables adaptations to test government's resilience in case of an unpredictable variable. And especially with variants of COVID-19, with other new pandemic, other new infectious disease coming up due to climate change, all this will happen in warp speed before we know it. Number 3, we need comprehensive monitoring. A lot of times we have nice words, nice plans on paper, but implementation on the ground is weak. That is why all people must be involved. And number 4 is reorganization of decision-making and implementation. This is where decentralization comes in, rethinking of the power structure, how to do it, and that's where political will is very, very important. And I'll just end with this. COVID-19 is a war that hit us all. So the approach in fighting back must involve us all. With that, thank you so much.
Thank you. Thank you very much, YB, for those clear words and call for us to work together. There are a number of questions in the Q&A and chat, but I just wanted to raise to all the panelists, because there is one theme that ran across clearly among all the speakers, and that is this need for representation, participation, consultation, dialogue, the voices, governance standards. So whether each panelist could, in a minute or two, just express how would you want government to do it differently from how y'all were doing before, because all of you have been either in Parliament or in direct policy dialogue and discussion. So what needs to change so that the voices of the people would really, without having to say we need to walk the street or we need, but government would really listen, and that we would be in partnership in this warlike situation for recovery. Can I start with Tan Sri Sharifah first? Just a minute or two.
I thought I said a lot about this. I think
differently, yeah.
How to do it differently? Yes. Now we depend a lot on digital technology, you know, so it becomes easier, in fact, to bring on people who can represent the voice of women, for example, or any group onto discussion. You don't have to travel, you don't have to pay allowances, you know, but to bear in mind that when you want to do it, when you want to form a committee, you want to form a task force, you have to remember you have to include all these voices. So I feel like using technology, using digital technology now should be more widespread. And even in this new council or task force for the recovery, I think we should engage even in subcommittees and so on, bring on board people for the different issues.
Thank you. Thank you very much. Use of technology, subgroups, including people into the process is critical. YB Maria, your view on how you would feel should be done differently so that all voices can be heard?
I guess that I will share with what APPGM has done in terms of looking for solution projects. We have actually started with including a lot of the communities to sit down with government agencies and stakeholders to come up with solutions so that it will be able to resolve problems at the community level. I think that will be the good start. And I think that a national recovery plan like this, you still have to go down to the nuts and bolts, because the people are the ones who are going to get the impact of what your plans are. So they have to be included. The other one is really about the economic recovery. We say a lot of training and getting the people back into jobs and all that. The other one is really looking into the SMEs. We really need to support them and give them not just the moratorium. Yeah, I think that they need a financial injection into the SMEs, a recapitalization of sort, so that they are able to have the additional resources to employ people. Now is that they have cut back on employees and all that. You want them to move forward. I think that, you know, one of these would be that the financial support for these SMEs. And I've talked to second-hand car dealers, furniture shop, those who make foams, and so forth. They say that, you know, we want to get back, but we need additional sources of funds to move forward. So I think that, you know, it's talking to all these people,
Sure.
capturing the voices.
Thank you.
Thank you.
Thank you, YB. Dato Parmjit, I thought all private educators and institutions were among the kaya investors. You presented a gloomy picture of private institutions. Most people say y'all are making good money through education. Sorry, Dato, not trying to tease you, but
I think that's a misperception. If you actually ask everybody who is in education, from an investor angle, they will tell you that they should have invested in something else. I can definitely tell you that. All right. But why we are here, you know, we are here for a cause. You see, many of us, we don't enjoy the fact that we have to face the public when they can't afford it. In fact, we don't enjoy it at all. And this is where, since asking for suggestions, I would actually ask the government to be a lot more empathetic and to understand the real state of where people are right now, their affordability levels. I've already said earlier, Denison, that, you know, we don't take pride in doing what we're doing because it is like running private health. You know, if you think that education makes money, then I think private health makes more money. You know, that's a comparison I will do. But both of these sectors are actually state matters. It should not exist. Yeah, it really should not exist. The fact that, you know, you and I all have to go to private health, it means there is a deficiency in the state system. The fact that 50% of Malaysian students have to subscribe to private education also means there's a deficiency in the state. So, you know, the private sector often responds to needs. It doesn't force anybody to accept their success. Just like restaurants, you have various categories of restaurants, fine dining all the way down with basic offerings for the poorer people. That kind of economic structures do exist anywhere in the world.
yes.
So, but education and health, really there are no excuses. Why are we here? So if we are here, the least the government can do is to support it, to bring the cost down so that the consumer doesn't have to pay so much. Yeah. You know, there have been a lot of calls, for example, by students, you know, reduce the fees by 50%. In fact, you're implying that there is a margin of 50% available to give away. There isn't. You know, asking for that means asking the university to shut down tomorrow because it will be operating below its cost levels. You know, it can't. It just can't. Just like a hospital also needs to be able to manage. And you know, the cost of compliance is so high. I mean, even in running a hospital, the cost of compliance is so high that everything is dictated in ratios, in bits and pieces like that, that keeps pushing the cost up. So I would think that there should be a reset with a long-range plan in mind as to how the state can participate and alleviate the high cost of education and health to the public, because really those industries need to survive. We either exist or we don't exist. If the state was sufficiently addressing the matter of education, then we will not exist. And I wouldn't mind not existing. Yeah. So, but we have only come in to fill up a gap, and really it is a thankless job having to meet so many requirements. At the end of the day, the proof is in the pudding. A lot of people define universities in many ways. It doesn't matter. I define it only in one way. The students come here with a purpose. They all come and spend good money. The parents have to struggle to put those that money aside to educate their kids. The parents' expectation is the children will end up in a job. Full stop. That's it. It is not about, how much the university has done beyond that. If we do not fulfill that basic need of being able to put that kid into a job, then we have failed. And that's the part that a lot of people don't understand. They go out there to proclaim their universities with all kinds of ranks and rates and all kinds of achievements, but why are we shy to assess ourselves on the basis of whether we're getting those graduates jobs? Jobs are important. I mean, a lot of academics don't believe in that. But otherwise, if they don't believe in that, why do you take kids, take 3 years or 4 years of their life, take so much of money from the parents, and then deliver a jobless graduate? What is the meaning of that? How can you take pride in the system like that? So at least our sustainability is on the basis of jobs. I know if my university stops the job opportunities for our graduates, if they don't start getting jobs anymore, we will fail and we will collapse. Nobody will come to us. So
Thank you.
Our judgment is on jobs. Full stop. That's
Yes.
what it is. Thank you.
Thank you. Thank you, Dato. Dr. Kelvin, before you catch your flight.
Okay, I'll just give a very short answer. How I think government should do different. I will sum it up with 3 E's. Number 1, engagement, engagement, engagement. Number 2, have empathy when they're engaging, understand real life realities. Number 3, encouragement, which is translated into tangible support. Last year itself, the economy lost more than about 500 billion since the first MCO. The economy right now is even in more vulnerable position. So that's why we need to have tangible support. With that, thank you guys so much. See you.
Thank you. Thank you, YB. There are a number of questions in the chat and in the Q&A section. Tantri Sharifah, I'm not sure whether you had a chance to look at them.
Yeah, I did. I do.
And most of them are addressed to you. So would you want to take a few of them or link them together? One is the role of NCWO. There is one on the need for counseling for frontliners. But other speakers can also interject.
Yeah, they can jump in and answer. But I would like to take up the one on the opening schools.
Okay.
Because we have submitted a memorandum to the government on making schools safer.
Sure.
Okay. Number 1 is, I think for secondary schools, for the above 12 years old, I think vaccination should be started soon for these children. And I think we should use very safe vaccines for them. But for primary schools, we are not talking about vaccination for them yet. But I think all teachers must be vaccinated. And I understand if you're already a teacher and you don't want to be vaccinated, there's nothing you can't sack or anything like that, But what I think we can do is perhaps put them in a position where they don't have to come into contact with the children. I don't know whether teachers would like it, but that's what we have to do. And the second one about the school is we are going to open. We have to make schools safe, not just physically safe, but I think mentally and emotionally safe for the children. I think our schools are not safe in this sense. There's a lot of harassment. You see the girl, that Ain case, what kind of harassment she's got, when she went public with her complaints. So we NCWO, we're working on a set of guidelines on how to make schools safe. Now, some of them are actually long-term, like changing amending the curriculum of the teacher training, for example, to include things like, issues on sexual harassment, the laws related to that, international laws related to that, But in the short term, NGOs like NCWO, we can go into the schools. They should allow us to go in and talk to the teachers. We can even do online, on making schools safe. Like some of the things like gender stereotyping is a very serious issue. That's the source of the inequality. Later, if it's perpetuated in the schools, and if teachers are doing it as well, then it becomes a problem. Then it's also about sexual harassment, sex education, talking about the sexual harassment code, concept of gender equality. These can be done together. NGOs can come in and assist with this. So if we want to really open the schools, let's do it properly and let's make the schools really safe for the children. About the counseling, actually it's not about counseling they're asking, you know, because they are being overworked, they're overburdened, the frontliners. Do we need more less working days, for example? Actually, we need to think seriously about them because they don't have the luxury of working from home. They have to go to, and they're working in very serious environment like ICU and so on, you know. So I believe that a longer rest days. So somebody suggested 4 days a week. In fact, maybe after that, after you worked, and then give a longer break, 1 week, 2 weeks, you know, and they can do this in rotation, I think would be good. In fact, NCWO has recommended more than just counseling. In fact, we feel that they have a lot of burden, you know, even financial. They have financial issues. Who's helping them, you know? So we were thinking like, you know, we can help them with providing grants for training, loan, or even money, you know, for going for training within or outside the institution, help them with money for funeral expenses, for example, yeah, for parents or immediate family. And also if their children do well, why not set aside some money to give awards? These will be things that will raise their spirits. You know, it's not just about counseling, you know, do other things that will alleviate their problems, you know. So I think these are some of my thoughts. Others can jump in and
Thank you. Thank you, Tan Sri. YB Maria, there is also one that's on empowerment of the community, either in terms of economic, psychosocial skills, and initiatives to document, integrated data system in the community, and so forth. If you want to take it in general, that might be, or in the earlier point that Tan Sri has highlighted, if you would like to comment on them, because, yeah.
Okay. I think that he's answering the question that he is, I guess it's a comment, and I totally agree that we need to, it needs a real paradigm shift, yeah. Although we've been saying all the time, participation, engage with the agencies, civil societies and all that, but it's not working as efficiently as we want it. So I would like to see that, you know, this national recovery plan will start off with engagement of the communities and see them as part of the solution. So the other one is really, I want to emphasize, is the data. It's not, we really need very, very detailed data so that we can actually analyze and focus. Say, for example, this COVID cases, what is given to us has always been accumulated data. So we can't tell where are these cases happening, and how any kind of breakdown in terms of location and how many are being vaccinated in terms of location and so forth. It would help the public, and also for analysts to actually determine, yeah, how can we actually help to target and do the contract tracing as well. So I hope that, you know, there can be a rethinking. If we are going to reset, then let us take both steps.
Yeah. Thank you. We still have a few more minutes. Dato Parmjit, you can comment on what was there, or you want to take up. I thought you raised a very important point that is often not discussed. It's actually the teaching learning environment, and actually molding the next generation. We know that the use of technology will be important. We will not be able to go back to big campuses, all that. So how is it that we can have this balance with the use of technology as well as socializing? I'm not going to talk about cost, I'm talking about the quality of education without compromising. And because you talked about the soft skills, team building, it's not just passing the exam. And that's the so can there be a sort of a change from the earlier system? That means your cost might come down because you might not need so many air-conditioned rooms. You might not want a physical library. It might be online. Lecturers are all online, but some small group study and so forth. Whether that would be in a recovery pipeline to bring costs down, but no compromise on education. What are your thoughts if that's a line?
Yeah, I'm totally in line with what you've just said. That is the direction we are all going. We think that going forward, it is going to be a hybrid system. There are quite a number of things that we will be able to do online effectively, whilst at the same time, we will also win on the social aspects, the integration aspects of students being on campus at the same time. I totally take on board your notion that it will bring costs down. We hope to go that way, and at the moment, the transition to online did not bring the cost down because the infrastructure is already there. Everything is there. It's that the government came up with rulings that now we are on lockdown, we cannot go to campus. Everything is there. But going forward, as we grow and we develop, yes, costs can come down because that will be part of the planning process. These days, books are, there are e-books, journals are online. That's when I said that we also need an enabling environment to look at the regulatory framework. Sharifah was in MQA and she's well aware that MQA itself requires a certain proportion of physical books in the library, despite technology being available. That's the type of revisions we are asking for. I know it will happen because there's a lot of wisdom in the system that's recognizing that going forward, technology is going to play a big role. So I think this is a time where we are engaging with government agencies, including MQA and Ministry of Higher Education, so that that enablement will happen. On the other hand, if you didn't know, we were set up as traditional universities. We were not classified as open universities or online universities. The license that we've got now is a temporary license to run online until the end of this year. And that's also something we're seeking for this to become a permanent feature so that we can plan ahead and become hybrid universities rather than traditional universities. You know, it will cut down a lot of cost, even at the individual level. Those who are traveling don't have to travel every day to the campus. Certain lectures they can go through online, and practicals they can still use the labs. There are lots of simulation software that's available that doesn't require you to physically come to the lab. But the university can become, you know, a place where everything else happens, the social elements and everything else, that needs to take place. So we are looking forward, and that's what I mentioned earlier when I spoke, that this is actually a reset, and it needs a lot of innovative thinking out of the box as to how we go forward. We are also researching a lot of reports that are coming out of American universities, their experiences, Australian universities and their experiences. So, you know, we are engaging a lot. On the other hand, we must also recognize that this has forced everyone who was traditional to go online. And, you know, there's a new form of competition. You know, what is stopping a student in Africa doing an online degree from Australia at a cost lower than coming to Malaysia physically? You know what I mean? So if online education actually substitutes physical face-to-face education, then, you know, the whole structure of higher education is going to change. But I believe that total online is only for those who are already working in adulthood, not for school kids who are coming fresh from school, trying to go into employment, because there's a lot of development on the personal side that one has to undergo before he's ready for employment. Thank you.
Thank you very
Denison,
much. Yeah.
Denison,
Well, yes.
if you have 1 or 2 minutes, I want to bring, I want to pick up on the point of using digital technology.
Ken,
Even
Tantri, there's
before,
one point I wanted to highlight to you.
yeah,
There is a very interesting comment by a university student who felt that I think panelists missed a point, which is communication. So he's saying there is a lot of confusing communication in higher education. Can't go to university, suddenly come to university, and the person says it's very worrying that in October, we are told we have to go back to the camp. So communication, if you can comment on that.
okay, we can, of course. There has been a complaint all the time that we are getting different ministry. One ministry says this and then another ministry will come up with something else. So I think maybe hopefully a council, a national council that integrates and coordinates, you know, and with one voice they come out and say what needs to be done.
Sure.
I agree to that. No, I wanted to say something else. Even before COVID, the NCWO, we were very concerned already about the excessive use of technology, even from young, preschool, kindergarten, nursery children, very young, 3-4 years, they are all using these gadgets, you know, and we know, you know, cyberspace is not that safe. You know, there's fraud, there's scamming, stalking, all kinds of things happening in cyberspace. So I think that, and because they are so dependent on the gadgets, and we are going to be more and more dependent on technology and all these gadgets. We have studied, our health people have studied, and they found, you know, not only physical problems from these children, you know, neck pains and eye problems, but also the breakdown in family relationships. You see people sitting at a table, everybody has got a phone, nobody is talking to each other. And this is carried on to what Dr. Parmjit says, in the school and in the campuses, it's going to be worse because everybody will be depending. And then with this kind of learning environment, we don't have the social skills. Already it's there, even before COVID, we are worried. So I think cyber safety and the use of cyberspace very responsibly is a very important component going. I think it's not just the digital technology for IR4 and for businesses, but looking at the impact on the population from childhood to adulthood. What's happening to our society when we overuse technology like this?
Okay. Thank you. Thank you very much to the panel. I think your presentation has complemented the morning session on the recovery. So the recovery is not just economic and health. We are looking at all aspects of human living, and definitely the points that we have raised on women, civil society, decentralization, new ways of education. The whole of community approach is quite critical. And most of all, would government give enough space to hear the voices, for the participation, so that there is a win-win situation in the process of recovery, because government can't do it alone. It must engage much more than it has done in the past, and technology can be utilized for that in that context. I think our time is up, and can I pass it back to the MC for the closing session. So thanks once again to the panelists, to Tantri Sharifah, to YB Maria, to Dato Parmjit, and to YB Kelvin, who I think is on his way to the airport for an interesting week next week, whether parliamentarians will be heard in parliament or not. So over back to the MC, and thank you to the KSI for this interesting round of discussion. Thank you.